Still to come then this morning, the local junior doctor taking Jeremy Hunt to task.
A junior doctor at Addenbrooke's Hospital in Cambridge has posted a personal message to the Health Secretary, Jeremy Hunt, on social media. Dr Nima Ghadiri says he believes that if a government plan to change working hours goes ahead, many doctors will resign. This is what he had to say.
Jeremy, this will be the final nail in the coffin for doctors thinking of quitting or moving abroad. When I went to New Zealand at the same level, my pay was twice what it was here. Jeremy, your party let the bankers keep their bonuses because you said you wanted to keep the talent in our country, or rather our city. Our doctors not considered the talent worth keeping. Now, if this contract goes through, I can guarantee you that the 27% of junior doctors thinking about moving overseas will become a reality.
And Dr Ghadiri will be talking to Dottie after the news bulletin.
Now, junior doctors will choose whether to strike in a vote next month in a row with the government over their working contracts. The announcement from the British Medical Association comes as one Cambridgeshire registrar releases a YouTube warning, an online video, to the Health Secretary Jeremy Hunt, saying many junior doctors will resign if the plans go ahead. The government says the current contracts are outdated and unfair, but critics argue the new deal could mean 15% pay cuts for doctors, with normal hours reclassed as being from 7 in the morning until 10 at night, Monday to Saturday. We'll speak to Dr Nima Ghadiri shortly about his message to the Health Secretary Jeremy Hunt. But first, our reporter Wazim Mirza has been gauging opinion to the new junior doctors' contracts in Cambridge.
I think, to be honest, even junior doctors in hospitals work an extraordinary number of hours. My thing is that hospitals is a fixed resource, and I think they really need to utilise the services of it as often as possible. And if that includes weekends, great.
It would worry me. I think it's something more than a human can do. If I pay you £1,000 and tell you to run a distance of 100 metres in 2 seconds, even if you die flat, you wouldn't be able to do that. There is a limit to people's capacity, tiredness, human factors, I think.
Well, they're obviously not getting enough rest. They're working too many hours, but as all jobs, you need to work the hours.
So we need to think about how much we're asking them to work and whether that's going to have an impact on us and our care.
Yeah, we do. We really do.
Is that your little one?
No, it's my granddaughter. I want to know that the doctor who's looking out for her or looking after her has had proper rest and can make the right decisions. They're not too tired. She's one. So, yeah, it's very important to me.
They're overworked and underpaid. I do believe that.
The government says the changes to contracts will mean basic pay will be higher. They will get overtime pay for working more unsociable hours. Is that fair?
I think it's very fair. I think they should get more. And I think they've been taken for granted for too long.
Are they going to live to see this? They're going to be, well, on the knees, aren't they?
Wazim Mirza asking the questions there. And well, with me now is Dr Nima Ghadiri, who is a speciality registrar at Addenbrooke's Hospital, a position which is still classed as a junior doctor. Morning, Nima.
Good morning, Dottie.
So these contracts then for junior doctors, they haven't been changed in 20-odd years, so presumably you're not against some kind of revamp.
We're not against some kind of revamp, but what we need as part of a revamp will be negotiations, not what we've been given, which is an ultimatum. And what Jeremy Hunt's given us is 23 proposals, of which he's not willing to negotiate even a jot on 22 of them.
But the BMA walked out of negotiations.
They walked out because a position of not even starting to negotiate on proposals which will impact on patient safety and doctors isn't a position to start negotiating on.
So you feel that he not negotiated first?
Precisely, yes.
What is it in particular about these proposals that you're so against?
Well, I think the most important proposal is this removal of safeguards. As doctors, as you heard from the doctors who were just speaking over there, we can get very tired. I mean, I myself am in the midst of a 4-week period in which I only get 2 days off. We can get exhausted. We do need these safeguards to prevent us from making mistakes. And the patients need these as well. And they've had these in the aviation industry for decades now, flight time limitations. In a job where you're dealing with people's lives and people's health, you do need these limitations. And if they're taking these away, then everyone's at risk.
But you will get paid for working more hours, won't you?
That's not being proposed. What's the proposal at the moment, and for junior doctors, and this is everyone from someone who's just graduated from medical school to someone who's about to become a consultant, is for the basic pay to be increased slightly, but they're actually removing the banding payment or reducing it very substantially for evenings and weekends. So what we just heard earlier about on-call payments going up, that's not actually true. Our on-call payments will go down. They're rehashing our working week to make it from 7 a.m. to 7 p.m. Monday to Friday to 7 a.m. to 10 p.m. Monday to Saturday. So the pay will go down in those hours. And crucially, it'll affect jobs which have antisocial working hours, such as A&E more. So accident and emergency will find their pay gets reduced even considerably more than it is in other specialities. So, for example, in our country, we can't fill 1 in 2 of our A&E posts. I don't think dropping their pay by 10 to 15% will really help that problem.
I mean, there are people, though, who work in the public sector, Nima, who have taken hefty pay cuts over the last few years, whose pensions have been completely changed, people who have lost their jobs. You know, there are many graduates in other disciplines who leave university and really struggle to get any kind of decent paid work. I mean, some people might say junior doctors are lucky. You leave university, you're more or less guaranteed a job in the NHS, and here you are moaning about having to work late.
I understand that. One thing about junior doctors is that we do study for 6 years at the moment, and if you started medicine after when tuition fees were increased, you do graduate with between £62,000 to £84,000 of student loan. On top of that, you have to pay for your exams and for your registration fees. It does add up quite a lot. And the point is that the risk of these pay cuts, and I do understand that junior doctors do get paid a lot more than other people in other sectors, but overseas the pay is so much more than it is over here, and the quality of work there, that there's a lure for junior doctors here to go over there. So at the moment, the poll shows that 70% of junior doctors would consider leaving the NHS if this contract goes through, and the lure of Australia, New Zealand, Canada may be just too much for them.
Nima, we'll have to leave it there. Thank you for coming in this morning. That's Dr Nima Ghadiri, who's a specialty registrar at Addenbrooke's Hospital.